Good day, everyone. We are Group 9, and for today's topic, we are going to be talking about assisting intravenous fluid insertion. For our group reporters, we have Abilidis Richelle Jane, Chua Geneva, Iscabas Joaquim, Layese Julie Angeli, Madrazo Eiffel Jane, and Paras Freya Erica. After 6 hours of varied online class activities, the Level 1 nursing students will be able to define terms related to assisting intravenous fluid insertion, give the importance of intravenous infusion, enumerate the purpose of intravenous infusion, explain the different scientific principles involved during intravenous infusion, discuss the types of solutions according to tonicity and purpose, cite the factors affecting IVF insertion as to its selection of sites, discuss the different types of IVF infusion systems, explain the different complications of intravenous fluid therapy with regards to insertion and administration of fluids, the nursing interventions to prevent or manage these complications, and the techniques in checking intravenous site patency. Identify the different venipuncture sites, discuss the nursing responsibilities before, during, and after IVF infusion, calculating for the following: drop factor, flow rate, number of hours consumed, volume infused, conversion of millimeter hour to drops per minute, conversion of drops per minute to millimeter hour, demonstrate the beginning skills in assisting IVF infusion, including assisting in intravenous infusion and discontinuing intravenous infusion. CLO number 1. Define the following terms. My name is Julie Angeli Layese, and I'll be your first reporter. Angiocatheter. A hollow flexible tube for insertion into a body cavity, duct, or vessel to allow the passage of fluids or distend a passageway. Antecubital spaces. The antecubital fossa in the anterior of the cubitus, or simply the depression in front of the elbow. It is the region where blood is commonly drawn from, since superficial veins cross through it. Blood transfusion. A procedure in which whole blood or parts of blood are put into a patient's bloodstream through a vein. Colloid solution. They are gelatinous solutions that maintain a high osmotic pressure in the blood. Donor. One used as a source of biological material, such as blood or an organ. Edema. A swelling caused by excess fluid trapped in your body's tissues. Embolus. A blockage or plug that obscures a blood vessel. Hemolysis. The destruction of red blood cells, which lead to the release of hemoglobin from within the red blood cells into the blood plasma. Hypertonic solution. A solution that contains more dissolved particles, such as salt and other electrolytes, that is found in normal cells and blood. Hypotonic solution. A solution that contains fewer dissolved particles, such as salt and other electrolytes, that is found in normal cells and blood. Commonly used to give fluids intravenously to hospitalized patients in order to treat or avoid dehydration. Isotonic solution. A solution that has the same salt concentration as cells and blood. Isotonic solutions are commonly used as intravenously infused fluids in hospitalized patients. Ischemia. Ischemia is a medical term for what happens when your heart muscle doesn't get enough oxygen. Ischemia usually happens because of a shortage of blood and oxygen to the heart muscle. It is usually caused by a narrowing or blockage of one or more coronary arteries. Intravenous infusion. Administration of fluids into a vein by means of a steel needle or plastic catheter. This method of fluid replacement is used most often to maintain fluid and electrolyte balance, or to correct fluid volume deficits after excessive loss of body fluids in patients unable to take sufficient volumes orally. Infiltration. is a diffusion or accumulation in a tissue or cell of foreign substances or in amounts of excess of the normal. It is the accidental leakage of non-vesicant solutions out of the vein into the surrounding tissue. This can occur with many antibiotics, dextrose solutions, or even normal saline. Patency, the state or quality of being open, expanded, or unblocked. A patent IV line is one that is correctly placed, allowing the treatment to flow directly into the patient's vein. Phlebitis, inflammation of the vein. With phlebitis, there is an infiltration of the walls of the vein, and usually the formation of a clot or thrombus in the vein. Intracatheter, a plastic tube usually attached to the puncturing needle, inserted into a blood vessel for infusion, injecting, or pressure monitoring. Recipient, one who is given something, such as blood transfusion or an organ transplant, that is derived from another person, the donor. Venipuncture, a procedure in which a needle is used to take blood from a vein, usually for laboratory testing. May also be done to remove extra red blood cells from the blood to treat certain blood disorders.
CLO number 2. Give the importance of intravenous infusions. First, it is an efficient way of providing a fluid or medication treatments for patients who have difficulty in taking medications orally. It is used to treat severe infections, nutritional deficiencies, and immune diseases. It also serves as a remedy for dehydrated patients, most especially the elderly. It is for administering antibiotics and for treating patients who suffer from chronic illnesses. CLO number 3. Enumerate the purpose of intravenous infusion. It maintains fluid and electrolyte balance. It replaces the fluids and electrolytes. It is used in chemotherapies, anesthetics, and diagnostic reagents. It aids in the regulation of blood or blood products. It also provides nutrients and nutritional supplements for patients who lack nutritional requirements. And last but not the least, allows intravenous drug admission.
Hello everyone, my name is Joaquin Miscabis, and I will be the one explaining the different scientific principles involved during intravenous infusions. The first is anatomy and physiology. We must have adequate knowledge of the many systems within our body, of which the integumentary, circulatory system, and the nervous system are of utmost importance. This is because when doing an intravenous infusion, the skin will be punctured, the insertion site of the IV is actually incorporated in the circulatory system, and lastly, the changes and the effects that the body may undergo is taken into account and is related to the nervous system. Next is chemistry. This encompasses the composition of the IV, referring to the numerous compounds and chemicals that make it up, and also results in the different tonicities, which is isotonic, hypertonic, and hypotonic. Next is pharmacology. This refers to the effect of the IV within the human body. More specifically, it is how the IV interacts with the human body and its systems, and refers to the possible consequences it may have, whether it be beneficial or detrimental to the human body. Next, we have physics. This relates to the notion that the medication goes into the vein instead of the blood squirting out. It takes into account the different pressures of the fluid, the atmospheric pressure of the bag, the density of the fluid. Next is psychology. This takes into account the mental state of the client receiving the IV. It includes the skills and techniques to soothe the client and to prevent them from tensing up. Instead, it utilizes techniques that helps them to relax and be more calm, which will further make the procedure more efficient and more comfortable for the client. Next, we have mathematics. This encompasses the precise measures of the fluid in milliliters being infused into the client. It takes into account the volume, the drop factor, the flow rate, and the duration. Now we have safety. This is relating to the safety of both the client and the nurse during the procedure. It takes into account the many possible risks that both the client and nurse will be exposed to during the procedure, and also includes the common practices that the nurse will undergo during the procedure to prevent any of these risks from happening. And lastly is sociology. It refers to the interaction of the client and the nurse. It refers to the nurse to nurse relationship, nurse to health team relationship. Any moment when the nurse is interacting with another person will be referred to sociology. Hello again, everyone. My name is Joaquin Miscabis, and I will be the one going over CLO number 5. Discuss the types of solutions according to the tonicity and purpose. The 3 tonicities are as follows: hypertonic solution, isotonic solution, and hypotonic solution. The first we will be going over is the hypertonic solution. The tonicity of the hypertonic solution refers to the osmolality greater than that of the extracellular fluid. It is an intravenous infusion of a hypertonic solution increases the osmolality of extracellular and causes intracellular fluid to shift out of cells and attempt to dilute the more concentrated extracellular. Overall, it causes the cells to shrink. Now the purpose. First of all, it restores osmotic equilibrium. It increases the solute concentration of the plasma. It draws water out of the cells into the extracellular compartment to restore the osmotic equilibrium. It causes cells to shrink. Pretty much, it draws fluid out of the cells and into the blood. We will now go over the isotonic solution. In relation to its tonicity, it has about the same osmolality as plasma and interstitial fluid. It can be added to intravascular fluid without affecting its osmolality and without fluid to shift into the cells. Pretty much, water will not be drawn out of the cell, neither will water be drawn into the cell. Its purpose is to replace or maintain blood volume. Additionally, it prevents sudden shifts of fluid and electrolytes in the body. Hello again, everyone. My name is Joaquin Miscabis, and I will be the one going over CLO number 5. Discuss the types of solutions according to the tonicity and purpose. The 3 tonicities are as follows: hypertonic solution, isotonic solution, and hypotonic solution. The first we will be going over is the hypertonic solution. The tonicity of the hypertonic solution refers to the osmolality greater than that of the extracellular fluid. It is an intravenous infusion of a hypertonic solution increases the osmolality of extracellular and causes intracellular fluid to shift out of cells and attempt to dilute the more concentrated extracellular. Overall, it causes the cells to shrink. Now the purpose. First of all, it restores osmotic equilibrium. It increases the solute concentration of the plasma. It draws water out of the cells into the extracellular compartment to restore the osmotic equilibrium. It causes cells to shrink. Pretty much, it draws fluid out of the cells and into the blood. So, as a quick recap, the purpose of the hypertonic solution is to draw fluid out of the cells and into the blood, while the purpose of the hypotonic solution is to draw fluid from the vessels and move the fluid into the cells. Meanwhile, isotonic solution's purpose is to replace or maintain blood volume, preventing no major shifts either in or out of the cell or in or out of the vessels.
Hello everyone, I am Geneva Kyla P. Chua, your reporter for CLO number 6 and 7. For CLO number 6 is to cite the factors affecting the IVF insertion as to its selection of site. First factor is the accessibility of the veins. Before inserting a needle into the patient's vein, assess its condition first. It should be a well-hydrated person that has a firm and easy-to-reach veins. Well-hydrated veins are bouncy and the right fit for insertion. Second is the size of the vein. Next is the condition of the patient's extremities. Fourth is the duration of the therapy. Fifth is the circulation. Sixth is the non-dominant hand or arm. The non-dominant hand or arm is usually chosen because it provides comfort and the patient can still perform simple functions using the dominant hand. It reduces the risk of being removed or lower the incidence of thrombosis or thrombophlebitis. Seventh is the patient's condition. Last factor is the type, volume, and rate to be infused. There are three common ways to classify IV fluids based on their tonicity. First is the isotonic. Blood plasma and isotonic IV solutions have the same concentration of solutes. If the total electrolyte content is roughly 310 milliequivalents per liter, then it is considered isotonic. For hypotonic, it has less concentration than plasma. If the total electrolyte content is less than 250 milliequivalents per liter, then the IV solutions is considered hypotonic. Last is the hypertonic. It has a greater concentration of solutes than plasma. IV solutions are considered hypertonic if the total electrolyte content is 375 milliequivalents per liter and greater. CLO number 7 is to discuss the different types of IVF administration equipment and infusion pumps. First, let's define IVF administration equipment. It is an infusion set. It is also known as a primary infusion tubing or administration set. It is used to determine intravenous fluids. Now let's go to the IVF administration equipment. Primary IV tubing is a set that connects to the bag of the IV solution. It is also used to infuse continuous or intermittent fluids or medications. Secondary tubing, it is shorter in length than primary tubing and no access ports and a back-check valve. It is linked to a primary line through an access port near the set stop. It is used to infuse intermittent medications or fluids. IV bags. IV solutions come in variety of solutions, concentrations, and volumes. Extension sets. A 10 to 20 centimeter length of IV tubing attached to an IV cannula is referred to as a add-on device. It helps in the reducing of micromovements at IV insertion sites and protects against BBF exposure during IV tubing changes. Needleless cap. It prevents the backflow of the blood. IV tubing with filter. Filters bacterial particulate and candida. Vented set. IV administration set used for solutions that are supplied in glass containers. Volume control set. A type of reservoir that holds a controlled volume of fluid from the IV bag. An infusion pump is capable to deliver fluids whether it is large or small amount and may be used to deliver nutrients or medications like insulin or other hormones, antibiotics, chemotherapy drugs, and pain relievers. There are 4 types of an infusion pump. First is the gravity infusion devices. It is the most common type of IV systems. It uses gravity to deliver medication and it is simple and low cost. Volumetric pumps is used for large amounts of medications. This has a smart pump which alerts systems if something goes wrong. Patient-controlled analgesia pumps. It allows patients to control their dosage. It is high effective and best implemented for specific medications. Lastly is the syringe pumps. It delivers small doses of high concentration medication.
A pleasant morning to each and every one of you. I am Eiffel Madrazo, and I'm going to be the one to explain the different complications of intravenous fluid therapy with regards to insertion and administration of fluids. the nursing interventions to prevent or manage these complications, and the techniques in checking intravenous site patency. So, number 1 would be phlebitis, inflammation of the vein. It occurs when the cannula is too large for the vein or if it's improperly secured. So, in order to prevent this, the caregiver should use the smallest needle possible, suitable for the patient and fluid being administered. The incidence of phlebitis can be reduced by use of simple measures. Good practice during insertion will also extend the life of the cannula. The clinician's hand should be thoroughly washed, gloves worn, and the patient's skin adequately cleansed. Good clinical practice must be observed when administering intravenous drugs, starting at the point of reconstituting and drawing of the drug. This standard of practice must continue to the administration phase, with particular attention paid to cannula sites of patients on frequent intravenous therapy, as regular use of the cannulas increases the risk of bacterial phlebitis. The second one would be the extravasation. This happens when the liquid in the IV leaks to the tissue surrounding the vein. It can also be caused by inserting a cannula that's too big for the patient. So, you must know your hospital's policy about the use of antidotes for vesicants. Ensure that the drug has been improperly diluted before injection or infusion. Select a small gauge catheter to minimize trauma to the vein and to let enough blood flow around the catheter to hemodiluted vesicants. Select the venipuncture site carefully. Don't probe for vein. Secure the catheter properly. The third one would be the air embolism. This happens when air bubble enters the vein. It could be fatal if not caught early, since the air can travel to the person's brain, heart, or lungs. So, in order for these to be avoided, you must ensure that the patient is properly hydrated and resting in a supine position when injecting and removing the IV line. So for the fourth one would be the hypervolemia. This is an abnormal increase in blood volume. It's more likely to happen in pregnant women, young children, elderly patients, or people with kidney problems. You can prevent a recurrence of fluid overload by tracking your fluid intake, following the fluid intake guidelines from your doctor, managing your thirst with sugar-free candies, ice chips, frozen grapes, and other low-fluid, thirst-quenching foods, ensuring you do not consume too much sodium. And so for the last one would be infection. If the IV line, port, or skin on the site of injection are not properly cleaned prior to inserting the IV, the likelihood of infection increases. So this can be prevented with proper sterilization and hygiene.
A pleasant morning to each and every one of you. I am Eiffel Madrazo, and I'm going to be the one to identify the different venipuncture sites. The first one would be the median cubital vein. It is located at the bend of the elbow. The superficial vein lies over the cubital fossa, hence, it is also called as the antecubital fossa. The median cubital vein has larger veins, and it is easier to see and feel. It variably forms as either an H or M type pattern, joining the media antebrachial, basilic, and a cephalic vein. The second one would be the cephalic vein. This superficial vein runs under the skin onto the other side of our upper arm and our lower arm, forearm, and the arm. Usually, a cephalic vein is used for a venipuncture site when scarring is present in the antecubital space or when the median cubital vein is hard to feel and see. The third vein would be the basilic vein. It is shown in the arm and forearm running along with the inner side
of the upper arm and forearm. Blood is commonly drawn in the forearm because veins in the upper arm turn inwards to become a deep vein. Basilic vein is usually the largest vein in the arm, often used for dialysis access, and the last vein would be the dorsal metacarpal vein. It is commonly found in the middle of the hand and used for intravenous infusion. So among these veins, the preferred one for venipuncture is the median cubital vein. It is because it is larger and has a lower tendency to move or roll when the needle is inserted. There are also fewer nerve endings surrounding these veins, making venipuncture less painful at this site.
Discuss the nursing responsibilities before and after the IVF infusion. Patient's name, bed number, and other identification must be checked. Age and diagnosis of the patient must be checked. Purpose of the infusion must be checked. The type of infusion fluid ordered by the physician must be checked, and also its strength, amount, and how long the infusion would take. Patient's consciousness must be checked and his ability to respond to instructions. The general condition of the patient, including being overhydrated and dehydrated. Infusion site and the site's condition must be checked. Abilities and limitations of the patient must be checked. Additional restraints must be checked. Check the experience and history of the patients if they have tried infusions before. Articles in the patient's unit must be checked. Check the articles, sterility of the chipsets and fluid, expiry date of fluid, and if there is any discoloration and suspended particles. Prepare the articles properly. Also prepare the patient and the environment, wash hands, and prepare the IV solution. The nursing responsibilities during the IVF infusions is to close the screw clamp and hang the bottle on the IV pole about 18 to 24 inches high. Connect the needle to the IV tubing and the protective covering must be removed. Flush the IV fluid through the needle until all air is removed, but not before opening the clamp. Prepare the venipuncture site and apply tourniquet firmly 6 to 8 inches proximal to the venipuncture site. Make the patient clench and unclench the fist and lightly tap the vein with the tips of your finger. Clean the area using a spirit swab and dry the area using a sterile dry swab. Insert the needle into the vein and secure the needle and tubing in place. Moving on to the aftercare, maintain the specified rate of flow throughout the procedure and remove the Macintosh and towel. The patient should be comfortable and clean the bed. If the patient is awake, instruct him or her not to make any hand movements. Collect and dry all articles used for the infusion and take them to the utility room. Send the blood specimen to the lab if there are any and record any information with date and time. Comfort the patient and observe any developing complications. Teach the family members to observe and report the conditions and to request assistance. The nurse must report the information to the relieving nurse and change the intravenous bottles when leaving the ward. Discontinue when the prescribed volume has been infused.
CLO number 11. Calculate the following.
So for the calculation of the drop factor, macro set is equal to 10 drops per ml, 15 drops per ml, 20 drops per ml. And for the micro set, it would be 60 drops per ml. And for the calculation of the flow rate, it would be volume times drop factor over time. And here is a sample situation. A physician orders 1000 ml of normal saline to infuse over 12 hours. The drop factor is 15 drops per ml. A nurse prepares to set the flow rate at how many drops per minute. So, 1000 ml times 15 drops per ml over 720 minutes is equal to 15,000 over 720 is equal to 20.83 or 21 drops per ml. So for the number of hours, it would be volume times drop factor over flow rate times time. So here is a given situation.
A physician orders 1000 ml of normal saline for infusion at a rate of 21 drops per ml. The drop factor is 15 drops per ml. At how many hours will the IVF infuse? So, you need to divide 1000 ml times 15 drops per ml over 21 drops per minute times 60 minutes per hour. So it would be 15,000 over 1,260, and it is equal to 11.9 or 11 hours and 54 minutes or 12 hours. And for the calculation of volume infused, it would be total infusion volume over total infusion time, and the unit would be ml per hour. And for the calculation of flow rate conversions, 5.1 drops per minute to ml per hour. So flow rate times time times drop factor. So here is a given situation. A physician orders 1000 ml of IVF to the infuse at 20 drops per minute using macro set at 10 drops per ml. How many ml will be infused every hour? So you need to divide 20 times 60 times 1 ml over 1 hour and 10 drops. So the equivalent would be 120 ml per hour. So for the another situation, 5.2 ml per hour to drops per minute. So flow rate times time times drop factor. So a physician orders 1000 ml of IVF to be infused at a flow rate of 120 ml per hour in a macro set using 10 drops per ml. How many drops per minute should the nurse regulate it to? So you need to times 120 times 1 hour over 60 times 10 drops per ml. So it would be 20 drops per minute. So for the demonstration of beginning skills in assisting IVF infusion, first, in assisting an intravenous infusion, the first thing that you would do would be perform hand hygiene. Introduce yourself and explain the purpose of the assessment. Third, confirm patient ID using 2 patient identifiers and compare the MOR printout with the patient's wristband. Assess the IV insertion site and transparent dressing and IV site. Inspect the patient's arm for streaking or venous cords and assess skin temperature. Assess IV tubing for kinks or bends. 7. Check the rate of infusion for the primary and secondary IV solutions. Verify infusion rate in physician orders or medication administration record. Assess the type of solution and label on the bag indicating when it was hung. Check volume of solution in bag. 9. Assist the patient into a comfortable position. Place a call bell in reach and ensure necessary side rails are used. 10. Perform hand hygiene. And last, document procedure and findings as per agency policy. And for the discontinuing intravenous infusion. So first, check the physician's order to see if the IV site is to be discontinued or if the site needs to be charged to an intermittent device. Second, clamp the IV tubing. Third, undo the tape by peeling the tape toward the IV site. Fourth, loosely hold a sterile cotton ball or dressing on the IV site. Fifth, withdraw the IV cannula, immediately put pressure on the site, and if possible, raise the arm so that the IV site is above the level of the heart. And lastly, hold pressure until the bleeding has stopped. This may This may be several minutes if the patient is receiving anticoagulant therapy.
Okay guys, that was the end of our reporting for assisting in IVF insertion. Thank you so much for watching. Goodbye, God bless, and stay safe.